it's easy to overestimate what will happen in a year, but underestimate what might happen in 2 or 5 or 10. If we looked at 10 years behind us now, we didn't have Facebook, we barely had Google, we didn't have Twitter, we certainly didn't have Uber and things like that. I think in a year from now, what's going to be really interesting is technologies like HealthKit and Google Fit and Samsung and other consumer devices enabling you to flow data through into the electronic medical record, and now many different groups, academic and otherwise, mining that data and providing what I call predictalytics on top of it to give you sort of personal check engine light, in a sense, is going to start to become reality. On my Apple Watch now, it'll remind me, Daniel, hey, it's time to stand up. But it doesn't have contextual awareness. I might be driving or on a flight and it's saying time to stand up. It's like not good timing for that. Imagine having that Google Now or the check engine light for your body on your wrist that's going to tie you to other services. I think right now on smartphones, if you're like me, you probably have 50 apps on your phone, and even 4 or 5 of them might be health related. It might help you track your vitamins or your activity or your sleep. Some are your social network, which can relate to health. And I think what I'd want to see in a global sense is that you don't have to go to fragmented apps. That information and the appification becomes integrated. And health may be something that's embedded in your home screen, and as a bit of a dashboard and as a bit of a reminder, depending on whether you're trying to do health and wellness or manage a disease or prevent one or do diagnostics. And so I think just like healthcare is very siloed among specialties and body parts, the apps tend to be, and the phone is still sort of a reflection of that. And I think as we go to more holistic, integrated, connected health and holistic health and medicine, we'll learn that all these things play together, from our voice, which can be used to diagnose depression, to Parkinson's, to our spending habits. And so I think as our smartphones shrink into our wrists, it may be that in a decade or so, we're going to have very different ways of interacting with information. The next generations of glass or augmented virtual reality. So the phone that we're sort of trapped into now may sort of go away as a health platform, but be integrated in other smart ways. The Internet of the Body, the Internet of Things coming together. And so I think the next few years will be the true convergence and the unsiloing of different apps and technologies and devices. So it won't matter which one you're wearing. It's going to be sort of device agnostic, but it's going to become insight leverage. You don't care about the raw data from the sensors in your car. You won't care about the raw data from your body and the Internet of Things. You're going to care when it becomes small, actionable, insightful information for you or for your patients or for your hospital or for your city or your country. The digital natives, the kids graduating medical school today grew up on Google and Facebook and Twitter. My generation, a little bit older, I finished medical school. There was just the beginning of the internet. I got my first cell phone when I was 20-something as a resident at Mass General. It's a very different world, and I think that impacts how our brains are wired. It's an overused example, but I like to ask, who's going to build the Uber of healthcare? And several companies have said they already are. The digital natives are used to having situational awareness, rapid interactivity, immediate, I want what I want when I want it right now, are going to want that in healthcare, and that's going to drive some of these smart innovations, whether it's the digital house call coming to you virtually, or actually a real clinician coming to your house using the digital doctor's bag that can fit in your pocket, whether it's enabling and democratizing healthcare around the world. I think the kids today, and I have a 12-year-old daughter who plays Minecraft like crazy, their ability to interact and wire with the virtual world and translate that to the real world, I think, is going to be increasingly important and shift healthcare in ways we can't even predict today.